And good afternoon, everybody. This is Art Shed, owner of the Shed Group, the MedicareHelpGuys.com. That's the website. Once again, MedicareHelpGuys.com. That is the website. Go to the website if you need a consultation, whether it be a Zoom meeting, whether it be a request to see someone in person, or whether it's a phone call that you would like to have. Set up your meeting time today if you have any questions about your plan. Folks, we've talked about in the last video about what's in your plan for 2025 when it comes to the Part A and Part B and the additional benefits. We stressed and kind of zeroed our attention on the zero premium out-of-pocket plan with the low out-of-pocket, I should say, and that's the HMO. We focused our attention on the zero premium HMO with the out-of-pocket of $3,700 and the PPO plan with the out-of-pocket of $3,800 that has a premium of $27 this year. Those are the two plans that we dealt with. We're going to continue down this road and deal with the prescription drugs. Why are we only talking about those two plans? Well, primarily because most of the individuals in our block of business are from Terre Haute, Indiana, over to Richmond, and then all the way from Indianapolis up to Fort Wayne. We have people, that's the largest swath of our business, okay? So for you individuals in that spot, majority of you are in one of those two plans. Now, there are people who have dual eligibility status and a few other people who have chosen different plans for various reasons. But the majority of you, one of those two plans, the HMO zero premium with the $3,700 or the $27 premium, $3,800 out-of-pocket PPO. So if you're not sure which plan you're in, go to your card, right? Go to your U card right now, look at your name, then you'll see your member number, and below your member number, you're going to see that plan name. And if it says AARP Medicare Advantage UHC IN0002 PPO, you're in the right meeting, right? If it says the AARP Medicare Advantage UHC IN12, you're in the right plan. We're talking about you. All right. So when we look at the prescription drugs, and that's what we're here to focus on, we focused on the other stuff. Now we're going to deal with the prescription drugs. Remember, right now, as it stands, you have 4 coverage periods in your prescription drug benefit in 2024. You have the deductible period at the beginning of the year. Then you enter the initial coverage period. That's where most of you will be for the remainder of the year. You're just going to pay a copay for your particular prescription and that be the end of it, right? There are people who fall into the coverage gap, which is the third part, right? In that coverage gap, you pay a discount price for the prescription drugs, but you're going to pay that up to $8,000 this year. And then if you happen to be a person who eclipses that $8,000 for 2024, then you fall into what we call the catastrophic window, where you pay a deep discount, a lower amount for your prescription drug costs. Okay, so that's how it stands today. Remember, we've been sending out newsletters talking about the change in 2025. It's here. Now that it's here, you might say the concrete is kind of set below our feet. We know how this system is going to work. So this is what you need to know. Next year, instead of 4, there's only 3 periods. Okay. You will have a deductible period. Okay. Then you will have the initial coverage period up to $2,000. Once your drug cost reaches $2,000 for the year, you enter phase 3, which is the catastrophic area. And this year, or 2025, in 2025, when you reach that catastrophic area, you no longer pay any more for your prescription drugs. That's a good thing. Okay. Now, let me give you the rub. So, listen closely. This is how it will work. I want you to look at your prescription drugs, right? If you are a person who only takes generic drugs, okay? In other words, right now, you don't pay anything when you go pick up your drugs at CVS or Walgreens, and you can verify that your drugs fall on the tier 1 and tier 2 level. Guess what? Materially, There's nothing different that you will see. Okay. So, really, at this point, if you're in that class of people, you can turn this video off. The rest of it is of no use to you, right? But I would warn you, okay, you may want to hang around because you need to think, what if my drug situation with my provider, what if my provider decides he wants to try me out on a different drug? Okay. If that be the case, here's what you need to know. And for other people who take tier 3, 4, and 5 medications, you must meet your deductible costs at the beginning of the year. All right. And for the majority of you, if you're in the PPO plan, you will pay $420 plus the cost of that tier 3 or tier 4 medication. So, for example, if it's Trulicity that you take, you're going to pay $420 plus the $47 copay for that particular drug in 2025. Right. Now, you may take other prescriptions, add that to your cost as well. Okay. When that cost reaches $2,000 for the year, what happens? Remember what I said earlier? You don't pay any more, but the big slog will be at the beginning of the year paying that deductible cost, right? Now, what if you decide that you don't want to pay that deductible cost? Well, talk to your provider and see if there's anything else that could be on the generic side that you can utilize. You don't have to. We're not saying that you got to do it. But if you decide to take that prescription that's a tier 3, 4, or 5 medication, you will have to honor that deductible expense at the beginning of the year. The good thing, again, is that once you reach $2,000, you don't pay any more for your prescriptions for the remainder of the year. So, look, again, for those people who only take generics, take the issue of the prescription drug and all the minutia around it, right, off the table for you. So then you're looking at your plan, looking at the out-of-pocket max again of $3,700 if you're in the HMO, $3,800 if you're in the PPO with the premium of $39 for 2025, right? So if you're in those super and you have generics, we're good to go. Again, we're good to go. If you're a person that takes tier 3, 4, or 5 medications, you must meet that deductible cost. Now, I'm going to tell you, I've taken a look at the other plans out there, whether it be through some of our competitors like Humana, Anthem, and the like. When you look at these plans, okay, some of you are going to see that the deductibles are as high as $590. And then on top of that, they've raised your out-of-pocket maximum to $6,700 or more, right? And if you happen to be one of those individuals who's focusing their attention on, let's say, the givebacks, look at the givebacks that they're giving people in these plans in order to be somewhat competitive. If you want a $125 give back, you could be looking at a premium of not a premium. You could be looking at an out-of-pocket max as much as $9,000. So from our standpoint, remember, there are 4 overriding principles that we start with when we're looking at your particular situation. Healthcare picture. That's what we do, right? It's our job to put together a retirement healthcare strategy for you. We want to mitigate as much spending as possible. So we're looking for the lowest out-of-pocket that we can possibly get from a plan that's stable, right? So if the premium cost is good, the out-of-pocket max is good, and you look at the fastest way to get to that medical in the hospital out-of-pocket, if that number is agreeable and it's at a low number, I'm telling you, you're in good shape. For those individuals who are looking at $6,700 for the out-of-pocket maximum, and then looking at spending another $2,000 for your prescription drugs because you take tier 3, 4, or 5 medications, I'm here to tell you the United Healthcare environment may be a better environment for you. Okay. Now, there are some plans that can get kind of tricky, okay, because they pass off, they say, a percentage of the cost. I'm here to tell you, I've worked some of the numbers, okay. In certain cases, the percentage cost of the prescription, it means that you'll have a longer slide, right, to get to $2,000. Okay, so it's a choose your own adventure. But again, When we look at the environment, I'm telling you right now, we have a stable environment. Okay. I would tell you again, if you know friends and family that may be in other plans, they may be on hesitation hill, folks. Feel free to give them our information. We'll be glad to help them with their prescription drug costs. The other thing I'm going to tell you for those people who are in our block of business, if you're not sure about your prescription drugs, send us an email, info@theshedgroup.com or info@medicarehelpguys.com. Send us an email, folks, and we will set you up with the drug estimator and estimate your drug costs for 2025. That way you at least have a working picture. Remember, it's an estimate, because one thing that could happen next year, what if your provider decides to take you off of a medication or put you on two other medications, right? So it's an estimator, right? It's not the end all and be all, because if all things hold consistent, it should be pretty close, right? But if your drug picture changes, it could be different. So all that being said, folks, we're done. Okay. The next thing that we need to talk about are all the other plans that United Healthcare has to offer, from the Give Back plan to the additional dental plan and the dual plans and the chronic plans. There's a lot out there this year. Okay. But in most cases, those are niche type plans. Okay. So, in a lot of respects, I would tell you it would probably still make sense to stay where you are as opposed to playing to one of those particular niches. Right. So, keep that in mind. All right, folks, like and subscribe. Tell your friends about the Shed Group, the MedicareHelpGuys.com. We have a lot to offer, especially in the way of information and how you should be thinking about your retirement healthcare picture. Folks, hope you enjoy the rest of your afternoon. And of course, as always, we look forward to serving you.